Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today I have a headache, so we're going to talk a little bit about headaches. I have been diagnosed with migraines in the past, but I also get different types of headaches. I also get more headaches around the time of the month that is my menstruation cycle. So there are also such a thing as menstrual migraines for those who aren't in the know. So today we're going to talk a little bit about different types of headaches, some causes for them, how they might be diagnosed, and some treatments. Even if you have migraines, there is hope through some different types of treatment, including some types of medications that can be very helpful for alleviating them or reducing their severity. So, as always, let's start out with an overview of headaches. We don't need to really define these, as everyone pretty much out there has experienced a headache at some point or another, so this is a ubiquitous human issue. Although I haven't really asked my cat if she gets headaches, so it might not be limited to humans. But you get my gist. Most of the time, headaches are not a sign of anything more serious, and they tend to get better on their own. Oftentimes, if you are anything like me, you may go through the motions of trying to figure out what is going on that's causing your headache. I go through a cycle of, have I eaten? Have I had enough water? Do I perhaps need some caffeine? Have I tried loosening up my hair bow if I have my hair in a ponytail or in a bun? Do I go ahead and loosen my shoulders and relax my jaw? And if that doesn't work, then we might be looking into something more serious, like some NSAIDs or something to alleviate some of that pain. But I'm not super big on taking NSAIDs myself if I think that I can weather that headache storm. Granted, everyone has different levels of comfort and discomfort and thresholds for these things, so do as you need to for your individual needs. I'm still trying to find that happy medium for my own. So with the headaches, if you are having a lot of them or they're becoming severe, then it's important to check it out with your doctor. And if you have any new problems or symptoms pop up, then make sure you also run it by your doctor so you can get medical treatment if necessary. There are many different types of headaches, and they can vary significantly in numerous ways. They can vary by their intensity, their location, their frequency, and also their cause. But we talk about headaches primarily in terms of primary versus secondary headaches. So a primary headache is when the headache is the main problem. So your primary issue is the headache. It's not a symptom of another disease or condition, like when you get perhaps a flu or a head cold and you have a headache as a symptom or something accompanying that. It's also not a side effect of your medication. So while the pain from that primary headache can be really debilitating, they're typically not dangerous. The brain itself cannot feel pain. It does not have nerve endings attached in such a way that it can feel pain. So the pain associated with those primary headaches are coming from inflamed portions of pain-sensitive areas of your body, generally those around your neck and head. And that can include your nerves, your blood vessels, and your muscles. So remember, not in the brain, but in the head and neck area. And sometimes that pain radiates out a little bit. It just depends on what is being inflamed at the time. And there are a few different categories of primary headaches. These are the ones we commonly refer to when we're speaking of headaches. Some examples include migraines, cluster headaches, tension headaches, and hypnic headaches. We're going to dive into those here in just a few minutes, but first I do want to go ahead and cover secondary headaches. Secondary headaches, as you very well may have guessed, are those that are caused by another condition that is triggering those pain-sensitive areas in your neck and head, like those nerves, those blood vessels, and those muscles. These are rare headaches, but they can also be a lot more serious than primary headaches. Secondary ones can be warnings of a more serious condition, like brain tumor, an aneurysm, neck or brain injury, or even meningitis, which can be caused by bacteria or viruses, making your brain become inflamed. So these secondary headaches usually start just out of nowhere. They kind of blindside you, and they are completely excruciating. So if you're having a sudden debilitating headache, and it is just absolutely crushing and excruciating for you, then go ahead and call your doctor ASAP. Some websites even recommend that you call 911 and get immediate emergency medical assistance, as it could be something more insidious than just a simple headache. Now I want to talk to you guys about the types of primary headaches. So first up, migraines, my old nemesis. So migraines are one of the most common forms of headaches, but not all headaches are migraines. Migraine is typically referring to a headache that is on one side of the head, but it can sometimes be on both sides. That headache typically lasts anywhere from 2 to 72 hours. So this can last like 3 days, you guys. And I have indeed experienced migraines that have lasted that long. A lot of times it is accompanied with nausea and or vomiting and sensitivity to light and or sound. And the type of pain associated with this headache is generally a throbbing type of pain. There are a few different categories of migraines though. So we have headaches, then we have primary headaches, then migraines, and then types of migraines. So within these categories of migraines, we have some that are preceded by a warning symptom, like an aura. And those are known as the classic migraine, or also called the migraine with an aura. If your migraine starts with just pain and you don't have any warning signs, then that's just known as a common migraine, or a migraine without aura. So I understand that can be a little bit confusing because one is common and one is classic, and those typically communicate the same type of concept, but that is what they are called. So if you prefer to refer to them with the aura component, you'll still be communicating the same thing, but perhaps in a clearer way. Now, what do I mean when I say aura? Well, a migraine with an aura means that you have some type of sensory disturbance at the time. That could be you seeing flashes of light, or having blind spots, or other vision changes, or even tingling in your face or in your hands. So these are the symptoms of what they call the aura. And without the aura, it's just the headache like it normally would be, and you don't have any of these sensory disturbances, whether that is in feeling or in seeing. If you have one of these or the other, you're generally going to receive the same treatment. And you can try to prevent migraines with auras with the same medications and self-care routines that you might normally use for other types of migraines. So with your migraine aura symptoms, you usually are going to get them about an hour or less before that head pain begins, and they generally last fewer than 60 minutes. But sometimes these auras can occur with only a slight headache or no headache at all, and that's more typical of people who are age 50 and older. And in addition to having that sensitivity to light and or sound, you may also have nausea along with that. Personally, in my experience, I tend to have more of an issue with light than with sound, and I don't typically feel nauseous. I just have a very intense headache along with that sensitivity to light. Most people who do have migraines with auras tend to have some temporary visual signs and symptoms, and if you have those, they'll start in the center of the field of vision and then spread outward. So think like when you pour pancake batter into a pan. That's how that kind of looks. So the blind spots are called scotomas, and those are sometimes outlined by some simple geometric designs, like circles, stuff like that. You may also see zigzag lines that float slowly across your vision. You may see shimmering spots or stars, flashes of light, or have those changes in vision or vision loss. You may also experience some type of numbness in one of your hands or on one side of your face, and it could slowly spread along a limb, or you may have some speech or other difficulties with language or some muscle weakness. So those can be pretty concerning because those seem like symptoms that are associated with strokes. So do make sure that you don't just count it off as a migraine and go talk to your doctor if you are concerned about that. You should also immediately see your doctor if you have any of the symptoms of migraines with auras, especially temporary vision loss or seeing any of those floating zigzags or spots in your vision, so that your doctor can rule out more serious problems like strokes or even tears in your retina. We're going to go on a quick break, and when we come back, we are going to talk about some causes and risks of migraines and take a dive into tension headaches. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Introducing the topic of headaches and then categorizing them further into primary and secondary headaches and then into migraines with auras and migraines without. So we've learned about when to go see a doctor for migraines, and now we're going to talk a little bit about the causes and risk factors. Well, we are not entirely sure so far what causes a migraine with an aura. Researchers have conducted some studies over the years, and they found some evidence that these migraines with visual auras, like those little floating symbols or the zigzag lines, can really be like an electrical or chemical wave that is moving across the part of your brain that processes your understanding of these visual signals. And that's in a place called your visual cortex. And they think that that may be causing those visual hallucinations. But many of the same factors that trigger migraines without an aura can also trigger migraines with an aura. And that could be stress, bright lights, some types of medication or foods, too much or too little sleep, and menstruation. So if you are starting to have migraines of either type, it can be really helpful for you and for your doctor for you to kind of keep a journal about what's going on with your life. I like to keep a bullet journal. I'm not going to lie to you, I am not great at always writing in my bullet journal. But when I do, it's kind of nice to have like 20 minutes to sit down and write things out. Your time may, of course, also vary. Use shorthand if you are in a hurry or you're not really enjoying journaling. But you can write down what you have been eating, which medications you took and at what time, and how much sleep you got the night before, and what your quality of sleep was. So if you didn't sleep all the way through the night, that might be a problem too, because you may have gotten 9 hours of sleep, but it might not have been quality sleep. Also, keep track of your menstruation cycle when you are experiencing these headaches. That is how I was diagnosed with menstrual migraines. So now I can at least predict them and perhaps prepare myself in as much as I'm able to whenever I know my period is coming. So you can have these risk factors for either of them. Keeping track of them is important, and also keeping a gauge on your stress. So if you want to do it in a bullet journal, it doesn't just have to be a scale of 1 to 5 from really not stressed to super stressed. You could do it like coloring in a thermostat drawing. There are so many different ways that you can do it, and Googling different types of bullet journaling is also a lot of fun. So find the best way that works for you. Perhaps even just use an app or notepad on your computer or your phone if you find that to be more helpful. If you're not using your Google Calendar for anything else, you could also use it for that. There doesn't seem to be any specific issue that increases the risk of having a migraine with an aura, but migraines in general do seem to be more common in folks who have a family history of migraines, and these are also more common in women than in men. So my mother had a history of migraines as well, and hers were also affected by the amount of hormones in her body. So when I first went on birth control, she gave me a heads up and cautioned me about it because she had had more headaches when she was on birth control. Now, I didn't have that experience, but I do have migraines in general, whether I am on birth control or whether I'm not. So I have, scientific methoded that one out, and that does not seem to be a total factor in my experience, or at least the amount of estrogen and other hormones in my birth control are not impacting me to the degree that it did my mom. But we both still have migraines. So family history can be a fairly useful predictor in my case as well. So that's my anecdotal experience. Definitely follow what the science says first, because they have much wider data sets than just me. And remember, those data sets are truly important. This week I met someone out in public while going to the store who said that they refused to wear a mask because 2 family members of theirs got COVID and it wasn't any worse than a mild to moderate cold. So she has decided that it is a hoax and she's not going to wear a mask anywhere. And she wasn't wearing a mask. I was. And I definitely felt some type of way about that, considering I had a family member who died from a COVID-19 infection a couple of months ago. Now, while it may be true that for that lady, her family members were okay, remember that 1 or 2 does not a sample size make. And I mean that for any time you're getting information from other people, not just from me. It's important to take a look at the number in these scientific studies for their sample size and their sample demographics, because it can tell you a lot about that population that it's supposed to be representative of. And that's why I always talk to you guys about the sample size numbers in all of these studies as we read through them, because they do matter. If we looked at just my experience with COVID-19 and people I know, then I know 3 people who have had it. 2 of them are still ill and we're waiting on the outcome for that, and 1 of them has died. So that means that in my family, if I were to just take those 3 numbers and pretend that other people don't exist, that would mean that there is at least a 33% mortality rate in folks who have gotten COVID-19. However, if we take this lady's experience, and we negated everyone else who has had that, then there would only be a 0% chance of it being fatal. So that is the problem here, is a lot of people are applying this anecdotal evidence blanketed towards everyone. And we can't really do that. That's why we take these much larger sample sizes, so these outliers can fall off. A lot of people are not going to die from COVID, but many people will still. And it is important, it's imperative to keep that in mind, because all of these people are someone else's loved ones. And wearing a mask is a sign of mutual respect. So I know I've gone off topic a little bit there, but I just wanted to mention that too and illustrate that it is important to keep these numbers in mind and that we should always be trusting the scientific authorities more than just a single person's anecdotal evidence. They put a lot of work into these studies and identifying what qualifies for the study and what doesn't, and are generally very transparent in that criteria. The scientific research is important. And it reminds me of a quote by Buddha, in which he says, "Do not believe in anything simply because you have heard it. Do not believe in anything simply because it is spoken and rumored by many. Do not believe in anything simply because it is found written in your religious books. Do not believe in anything merely on the authority of your teachers and elders. Do not believe in traditions, but just because they have been handed down for many generations. But after observation and analysis, when you find that anything agrees with reason and is conducive to the good and benefit of one and all, then accept it and live up to it." This is really an argument to just not blindly believe in everything around us. And that's not to say that you can't believe anything, but it is saying be a little bit healthy in your skepticism. So look further into something than that which an authority figure has told you, or that which you've heard on the radio, or even a podcast. Remember, science continually changes. We might not have an update on what specifically is causing these migraines with auras today, but that revelation could come as soon as tomorrow. And then these older episodes will be a little bit out of date. That's also why science requires that you generally keep your references in your publications to within the past 5 years, so that you have the most up-to-date information to be included in there, and you're not relying on these very old ways of obtaining information or analyzing them that perhaps don't work anymore. And indeed, that's something that we learn in anthropology classes too. So I had one professor who made us go through the entire history of anthropological theory and learn each of these theories. And once we understood them very well, he would say, okay, now here's why we don't use these anymore. Here's why we've moved on to something else. And this is why these are no longer valid. And at the time, it was like, man, why are you teaching me this thing that's not valid? But as I got older and as I progressed through the class, I understood the point of it. And it is to make sure that we're not just accepting these things as they are just because they have been used by people who are famous or strong authority figures in the past. It's important for us to critically evaluate these things on our own. And that's what promotes paradigm shifts. That's also what promotes peace and understanding. So whether it be related to Buddha or anthropology or migraine headaches or COVID-19, it's really important to make sure that you're getting sufficient knowledge from valid, knowledgeable sources and really testing that out for yourself, weighing that out and seeing, does this hold true and factual beyond it being merely speculation or just being a popular rumor that many people believe. I am always an advocate for obtaining more information and asking more questions. It is okay to say that you don't know and then go out and seek more info. And in that regard, there are a lot of free classes online from edX and Coursera and Khan Academy, Code Academy. Anything you want to learn is out there for free on the internet. And I highly recommend that you go and seek some of this information for yourself. We're going to go on another break. And when we come back, we are going to talk about tension headaches and menstrual migraines. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
We were talking about migraines with and without auras, as well as COVID-19 and how Buddha ties that all together when we are talking about evidence related to scientific issues, especially those that are biological, like COVID-19 and these migraines. So now we're going to talk about menstrual migraines and tension headaches. We now know the difference between migraines with auras and those without. And I briefly touched on how hormones can impact your headaches. But now let's talk a little bit more about why or how. women tend to have more headaches than men do, at least in the literature that we have so far. And so we've noticed a relationship between headaches and changes in hormones. So estrogen and progesterone both play important roles in regulating your menstrual cycle and pregnancy. And that's why you find one and or both of these a lot of times in birth control pills. But they can also have some headache-related chemical alterations that accompany that process. So if you have a steady level of estrogen, that can help improve your headaches. If you have estrogen levels that dip or have any type of variation, that can actually worsen your headaches. These fluctuating hormone levels can influence your headache patterns as well, which is why some people tend to have more migraines at certain parts of their menstrual cycle. But it's not just hormones that can cause these or influence them. So your doctor can help you treat or prevent these hormone-related headaches. When you're going through your menstrual cycle, there is a drop in estrogen right before it's time for your period, and that can contribute to headaches. A lot of women who have migraines report that they have headaches before or during menstruation. And in that way, your menstrual migraines can be treated in several ways. And that can include holding a cold cloth or ice pack to the area that is in pain. Remember to follow the advice of doctors and only keep that on for 10 to 20 minutes at a time, and then 10 to 20 minutes off, back and forth, and to wrap it in a towel or some other type of fabric to make sure that you are not damaging your skin with the cold. You can also try some relaxation exercises to lower your stress. So overall stress can promote the likelihood of getting these headaches. So as I mentioned earlier, when I'm going through my headache list, I check for if my ponytail's too tight, water, caffeine, food, and then I also relax my shoulders. I drop them. So if you have not dropped your shoulders today, go ahead and do that with me now. And relax your jaw. If you have your teeth clenched or your tongue cemented to the roof of your mouth, relax those muscles too. Those are all very important. Relax your temporal muscles as well. Your jaw is actually anchored up there too. There are many large and small muscles in your craniofacial area. So your face, your head, and even down the top part of your jaw and your neck. And these are all anchored to your skeleton. That's the way that your musculoskeletal anatomy works. The muscles have to be anchored to something. So if these muscles, especially those like your pterygoid or your masseter, these muscles that are associated with chewing and with your jaw, if those become too tight, it can cause a lot of pain as it relates to that area of your head. And so with your head and your neck, remember that's where all of these nerves and muscles and blood vessels are that can result in a headache. So loosening those up by relaxing those muscles can very much help relieve a headache. It may sound silly that I'm saying that you should drop your tongue from the roof of your mouth or make sure that you are not clenching your teeth per se, because you're like, hey, it's not my teeth that hurt, it's not my tongue that hurts. But they could really be contributing to your headache by causing that stress, whether that is physical or whether these are physical manifestations of your mental or emotional stress. So it's important to keep those in mind and perhaps follow along with some of those relaxation exercises that we have discussed in previous episodes. You can also do some mindful meditation if you would like to alleviate stress from the mental and emotional places in the self rather than just the physical. For me, I tend to carry all of my stress in my stomach and in my musculoskeletal system, so I do also focus on the physical aspects. But again, the mind and body are connected, so working on one of these can help the other, and by doing both, it very well may help even more. We've also spoken previously about biofeedback. Biofeedback can help improve your headaches by helping you be attentive and conscious of how your body responds to stress. If your heart rate is increasing and that is causing some issues with your blood vessels that's leading to headaches, being trained in biofeedback can also help you be aware of the response to predict if you're going to get a headache and also help you lower it on your own. So I encourage you to check out our episode on biofeedback, talk to your doctor about it, and look up more about it online if you are interested from reputable sources. You can also do acupuncture to help improve your headache and help you relax, or take some over-the-counter pain relievers. Oftentimes, doctors are just going to flat out recommend that you take an NSAID. So we did an episode on NSAIDs, non-steroidal anti-inflammatory drugs like naproxen sodium, or ibuprofen, or acetaminophen, so on and so forth. But your doctor may also prescribe you a type of medication called triptans that are meant to block pain signals in your brain. So they can relieve the pain from your headache within about 2 hours and help control any vomiting if vomiting is one of your symptoms. Some women in particular take a combination of NSAIDs and triptans to relieve that pain that is specifically associated with menstrual migraines. And then some doctors may suggest other pain medications like DHE45, but you cannot take those in combination with triptans. My doctor has put me on a medication that I only have to take at the onset of the migraine, and you take it and then lie down in the dark for about 15 minutes or so, and then it should help the headache go away. She refers to it as an abortive medication because it's meant to abort the headache. It's meant to stop it in its tracks before it can really come to full fruition. So you may want to talk to your doctor about the possibility of those as well. I like that I don't have to take them all of the time and only had to take them as needed. If you have a lot of debilitating headaches in a month, then your doctor might recommend preventative treatment though. And that's generally going to be either NSAIDs or triptans, or perhaps even both. If you have a regular menstrual cycle, then it may be effective to take the preventative medication starting a few days before your period and continue that for up to 2 weeks after the start of your period. If you have migraines throughout your menstrual cycle, or you have irregular periods, then your doctor might recommend that you take preventative medications every day. Again, we're all different, our bodies are different, and so whatever works best for you and your body and your doctor are what you may end up doing. But I just want you guys to be aware of the possibilities so that you're prepared when you go into these conversations. If they prescribe daily medications, that might include beta blockers or anticonvulsants or antidepressants or even magnesium, as well as calcium channel blockers. And your doctor might also consider giving you a monthly injection of CGRP. That's short for calcitonin gene-related peptide, and it is a monoclonal antibody to help prevent your headaches. But this is generally a step that's taken if the other medications have not been effective. Then your doctor will go ahead and look at other medical conditions that you might have to see which medications might be the best for you. Remember, they need to know about supplements that you're taking as well, and that includes herbs and different types of minerals, different types of vitamins, whatever else that you are not getting from the sun or from your food, but you are putting in your body. They need to know about that to see if there may be any other interactions. You can also try making lifestyle changes, like reducing your stress, making sure you're not skipping meals, and exercising regularly. I just moved, and I have already found a new local gym to start going to. Making sure, of course, that I practice proper social distancing and wearing my mask. They also have a lot of these hand sanitizer and cleaning sprays available, along with cloths that they can wash afterwards. So it is sustainable, and it is a good approach for preventing the spread of COVID-19. I've also replaced a lot of my gym workouts with going hiking in the mountains. I have a 3-mile hike planned for this upcoming week, and I am very excited to be hiking in the actual mountains once more. So I'm looking forward to that, and to also being aware not spreading COVID-19, especially while I work on minimizing my headaches through a health and wellness routine that is largely focused on centering my mind and my body. In addition to these types of steps, we also need to make sure that we're considering hormonal contraception methods. I know that I have mostly been talking about birth control pills today, but patches or vaginal rings can also affect your existing headache patterns. They might improve, or they might worsen, or they might stay the same. Hormonal contraception can also reduce the frequency and severity of menstrual migraines by minimizing that drop in estrogen in your menstrual cycle. So you can use hormonal contraception to prevent or treat menstrual migraines sometimes, but for other women, like my mother, it might make it worse. And it just depends on your individual body, and different things are going to be appropriate for different individuals. Other folks who have uteruses may also first experience migraines while using hormonal contraception. And if you experience migraines while using hormonal contraception, talk to your doctor. Now that also makes me think about folks who are transitioning, especially folks who are transitioning from male to female. So there was a recent study in the Netherlands that found in the male to female transgender population, about 26% of patients who transitioned adopted migraine characteristics, and that's about the same as the general population. Right now, that's the most complete data set that we have, according to Dr. Barbara Nye at the Headache Clinic at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. And she's also an assistant professor of neurology at the Geisel School of Medicine. So I wanted to bring up that study because, when you're on more estrogen, whether that be what your body is naturally producing or that which your body is being treated with, either to help you transition or to ease other types of transitions, like those into menopause, it could impact your body in a variety of ways. So estrogen can sometimes make headaches better, sometimes make headaches worse, or make headaches arise when there were none before. It's those that are associated with hormones. We know that hormones do play a role in migraines, but we're still looking into exactly what they do, exactly how and why they cause them. And Dr. Nye points out that patients on hormone therapy are often also suppressing some other hormones, and they're keeping more consistent levels instead of having peaks and valleys, as folks who menstruate or who are going through menopause typically do. But we need more data to tell us what's going on with these specific types of patients so that we can best help them out and predict their specific migraine symptoms and onsets. Researchers like Dr. Nye would like to do some more research overall, and they've also said that they are not saying that hormones are a primary cause of headache in transgender individuals, but rather that it's more likely it's your underlying genetics, like with my family history with my mom having migraines and me having it. And we're going to have to see a little bit more as this body of research builds over the years. So if you're looking for a dissertation project and you are in the LGBT community specifically, this is something that you could study to help out an underserved population and do some good in the healthcare industry in helping individuals who are undergoing transition have better outcomes when it comes to the transition process by perhaps preventing or even eliminating these headaches. If you'd like to read more about this particular article, you can go to the American Headache Society and check out Migraine in Transgender Patients as the name of the article. We're going to go on a quick break, and when we come back, we're going to talk about those tension headaches. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about menstrual migraines and the general role that estrogen in particular and hormones in general may be playing in the onset of headaches, as well as their timing, and how that also impacts anyone who is on estrogen. So if you are transitioning, especially from male to female, or into the menopausal stage, then whenever your hormones are fluctuating, it may result in headaches. So they can also help alleviate headaches. Weirdly enough, we're still trying to figure out exactly how that works. But no matter what the cause of your fluctuating hormones are, you can speak to your doctor if you're getting more migraines while using hormonal contraception, or if you're not on hormonal contraception, maybe speak to your doctor about that to see if it can alleviate some of your headaches. If you're going to use hormonal contraceptions, doctors recommend you use a monthly birth control pack that has fewer inactive placebo pills. So you want just straight up active pills perhaps, and that way you are on the same regular, steady amount of estrogen and you're not having those peaks and valleys. You can also eliminate the placebo days completely by taking an extended cycle estrogen progestin birth control pill. So an extended cycle combo pill like Seasonique. So those where you don't really have your period, or you only have it for 3 or 4 times per year. You can also use birth control pills that have a lower dose of estrogen to help reduce the gap between the peaks and the valleys that come with placebo days, if you do prefer placebo days. Or you can take NSAIDs and triptans during the placebo days, or take a low dose of estrogen pill, or wear an estrogen patch during the placebo days. But definitely don't do that without speaking with your doctor. There is also something called the mini pill, and that's a progestin-only birth control pill. And you might have heard it referred to as Ortho Micronor or Camila. Those are just a few of the brands. And that is an alternative to the combo pills. So if you can't take estrogen, progestin, birth control pills for whatever reason, then there is an alternative, and you can perhaps speak with your doctor about those. Speaking of hormone changes, pregnancy also comes with quite a few of those, right? So in those cases, migraines typically improve or disappear altogether during pregnancy. But tension headaches usually don't improve because those are not affected by hormonal changes like migraine headaches are. So we're going to talk about tension headaches a little bit right now. Tension headaches are the second most common type of headache after migraines. A lot of times, folks refer to them as being hat band headaches because they are painful around the back of your head, your temples, and your forehead, like you're wearing a hat that is far too tight. They also tend to feel like it's severe pressure at onset, and they can last from hours to a few days. Also, horrifyingly, tension-type headaches can also exist at the same time as migraines, or you can get one and then trigger the other one into being as well, or one can slowly morph into another. Tension headaches are usually responsive to physical therapy, relaxation types of therapy, and either anti-inflammatories or muscle relaxants. Tension headaches can be just as painful as migraine headaches. The differences between the two are not related to the amount of pain, but rather where it's located and how it's presenting. So we're going to compare and contrast those real quick. So with a migraine, you typically have pain on one side of your head with pressure behind one eye. That's generally how mine is presenting, and it feels like there's like a little man behind my eye just tapping at it with a small hammer. And the pain is usually throbbing or pulsating in this headache, and it's generally moderate to severe. The pain can get worse with normal physical activity, which is why when you have a headache, they want you to lie down in the dark. Nausea or vomiting may accompany the migraine, as may light and noise. Having a runny or stuffy nose alongside the migraine is not uncommon. You may also get diarrhea or fatigue with it. I typically get fatigue with it and am just feeling totally drained when I get these headaches. They can begin at night and when you wake up from sleep. Mine are normally at the onset of when I wake up. I just wake up with a headache and know that's the way my day is going to go. Fortunately, I can sit relatively in the dark most of the time and just let it pass through, but not a lot of folks are able to do that. So if you have folks in your life who are experiencing these migraines and you're in a position to help them out, like if you're their boss and they are calling in with a migraine or letting you know that they have a migraine, it's the kind thing to do to go ahead and ask if they need the day off. It's just nice to be nice. It's good to be kind. And a lot of times folks with these migraines really need that, and you're not going to be able to get as high quality of work from them at all from a management perspective while they have the migraine, because everything hurts at that time. So just having a little bit of empathy for folks who are going through migraines can help a lot. And I hope that if you didn't know anything about them before, that this helps you to understand a little bit more from their perspective. At my old job as a manager, I would let people go home early with migraines, of course, and I would also offer to let them go home early if they were on their periods, because that's something that I was able to do. There was no rule against that at all, and if there had been, I would have been having words with my bosses about it. But you can make those changes in your workplace too. I was the only female manager out of 11 managers on my first business unit, And so that was just something that never occurred to my male counterparts because they did not go through it themselves. So that's something I started offering, and just making sure that these folks who had uteruses were able to take the day off if they needed it. If they felt that it wasn't that bad and they could power through it, they often did. But I like to give people the option. It also is solid for company culture and just for being a good, considerate leader. There's no reason to make people be there, even from a management, purely business perspective, if they're not going to be able to work anyway. And you're more likely to get higher quality work if they need that break. And in that regard, it doesn't matter to me whether the headache is real or fabricated. But if you create a culture in which your employees know that when they come to you, they can tell you the truth and just be totally honest with you and still feel heard and validated, they are way less likely to lie to you. I can tell you that straightforward. In addition to headaches and menstruating, I also had a rule on my team that if you just felt burnt out, you could let me know at any time and we would schedule a 3-day weekend for you post-haste. Or if you just could not take it anymore that day, to come and let me know so that we could go ahead and let you go for the day. So that people were able to be humans. That's what we're all doing here, guys. And everything, again, is interconnected. Your health and wellness do matter when it comes to work output and company culture and vice versa. All of these things matter. And if you're in a position to change these things or anything else at your workplace to enhance the environment, I encourage you to do so. So, segue aside, the difference between migraines and tension headaches is with tension headaches, you can have a tension headache on both sides or all over your head instead of just on one side. Now, migraines can also be all over your head, but they're usually on one side with pressure behind one eye. While migraines are throbbing and pulsating, tension headaches are generally more of a deep pressure or tightening headache that doesn't really throb or pulse, and it's mild to moderate instead of being moderate to severe. Physical activity does not make tension headaches worse the way that migraines get worse with physical activity. And there's no nausea or vomiting with tension headaches, like there may be with migraines. Tension headaches might be worse around light or noise, but generally not both. And they may last for minutes to several days, much like migraines, which can last from a couple of hours to 72 hours on average. But I do know folks in my personal life who have had them for a week or more and had to go to the doctor for that. So if you're having these migraines for more than 3 days, that's typically considered to be abnormal, and I encourage you to reach out to your doctor. Now, in addition to these types of headaches, I do want to also talk a little bit about cluster headaches. Those are usually on one side of the face, head, or neck, and it does not tend to switch sides. It presents as a piercing type of pain that has a really quick onset, and it gets really bad really fast, usually within literally 5 to 10 minutes. Lying down often makes cluster headaches worse instead of better. So if you lie down thinking you have a migraine headache because it's on one side, but lying down makes it worse, it's more likely to be a cluster headache. If it gets worse while you are moving around, it's more likely to be a migraine. If you have a cluster headache, it may also be accompanied by nasal congestion or a runny nose, watery eyes, or your pupils may get very small. You could have droopy or swollen eyelids. You may sweat on your forehead or face. And these headaches are the type that may even wake you up at night. You also may have sinus headaches. If you've ever had a sinus infection, I know that you have likely felt that pain. these are typically felt around your eyes, your cheekbones, your forehead, and the bridge of your nose, because that's where a lot of your sinus cavities are. You have them in your frontal bone, which is the bone that makes up your forehead. You have them in your maxillae, which make up your top part of your dental arcade, so your teeth that are in the top of your mouth, as well as the parts of your face that go right up in a little skinny line up towards your bridge of your nose, and these connect to your cheekbones, your zygomatic bones. You also have some up and behind the inside of your nose. That's called your ethmoid sinuses. So you have your frontal sinus, your ethmoid sinuses, and those maxillary sinuses. So if it's above your forehead, or on your forehead rather, that's going to typically be your frontal sinus. If you are having it down on your cheek, between like your eyes and your teeth, that is typically going to be your maxillary sinuses. And if it's around the bridge of your nose area, like between your eyes, those are your ethmoid sinuses. So those are just these little pockets of air, essentially, that are in your bones. And those have a lining in them. They have a mucous membrane. So that lines your nose, your sinuses, and your throat to help warm and moisten the air that you breathe in. But if things get stuck in there like particulates, then it can make sticky mucus to help rid all of that dust and those other small particles like pollen and crap like that out of your respiratory system. But those sinuses are just these large air-filled chambers in the bones that are in your facial area, and mucus from them drains into your nasal cavity. They're pretty cool to look at in bones, and if you don't have access to a skeletal collection near you, definitely check out pictures of them online. I think that they are pretty fascinating, the way that these work. I've seen these in a lot of different skeletons over the years, and it's nice to be able to visualize specifically where my sinus pain is coming from. At least for me. I like to be able to understand it. Now, those aren't the only sinuses that you have in your body, or even all of the ones that you have in your head. But I just wanted to mention those specific ones, as those are often the ones that are impacted by these sinus headaches, at least in my experience and that of many other folks. If you haven't had a sinus headache before, it's a deep and constant headache pain, and if you lean over or move suddenly or exercise, you may make your headache worse. Symptoms that accompany a sinus headache and can help you set it apart from other types include a fever, green or gray discharge from your nose that lasts more than 7 to 10 days. And that's really what sets the sinus headache, nasal congestion, or runny nose apart from the migraine and the cluster headaches that also have those issues. They're normally not accompanied with that discharge. But if you've ever had a sinus headache, you may be familiar with that gross gunk that comes out of your nose, and sometimes it really looks like it's has the imprint of a bone on it or something. If you're familiar with what sinus cavities look like in bones, then you can really look at it and see that it's shaped kind of like that. And those are the coolest ones to me, the most interesting. I know that probably sounds gross, but let's be honest, most of us do look at our snot after we blow it to see how weird it is. Or at least most people I know do. At least we admit it, is what I'm getting at. And if you take a look at it, that's because it is adhering to the shape of your sinuses. And that is pretty indicative of a sinus headache. In my experience, it tends to be thicker than mucus normally is, and it's going to be greenish or gray colored. Sometimes you might have a little bit of speckling of blood in there. If you have blood in there, you may want to talk to your doctor, because that can be due to one of many different issues, including allergies, infections, your tissues drying out or just being irritated, or blowing your nose or rubbing it a lot. It may sound gross, but there's a lot we can tell from snot. Lastly, in addition to examining your snot for telling what type of headache you may have, a sinus headache may also present with your ears feeling plugged or kind of full, or like they might need to be popped, like you're going way up or down a mountain or on an airplane. Or you may have some swelling or puffiness in your face. Those are 4 of the major types of headache, but I want to end this episode by also covering a rare type of headache, just in case any of you out there are experiencing this. The hypnic headache is a rare form that occurs in folks who are generally between 40 and 80 years old. It occurs exclusively at night and lasts usually between 15 minutes to an hour. They also tend to happen at the same time each night and tend to be on your entire head, not just one side, like migraines typically are. And they are not associated with runny noses or tearing up or any of the other types of features that generally accompany cluster headaches. They do have specific treatments for that type of headache, especially those that don't respond to usual headache medications. So if these have been plaguing you, please reach out to a doctor and ask if perhaps you may be presenting with hypnic headaches. I hope that you all have learned a lot about headaches with me today. I know I sure learned a lot. And after some caffeine this morning and some food, I feel a little bit better. The headache's still lingering, but it has dulled quite a bit. So that headache troubleshooting has worked out pretty well, I'd say. I'm down to a mild headache instead of a moderate to severe one. If you're also experiencing a headache today, I encourage you to drink some water, perhaps lay down if you are able to, and put a cool compress on the part that aches. Remember, 10 minutes on, 10 minutes off, and also have a cloth barrier in place to prevent tissue damage. If you have any particular headache remedies that specifically work for you that we did not cover today, please do share them with us at the GSMC Health and Wellness podcast page for Twitter, Instagram, or Facebook. I am always here to try out these new remedies, anything to make these headaches go away. Thank you for listening to the GSMC Health and Wellness podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.